As you know, Edward, I've been looking at a little bit at the term talk therapy, which I just came across accidentally, if anything can be called an accident. And I started looking at some of the self-help videos that are on YouTube and on these sites actually that speak about talk therapy. And I made a list of some of them, not all. It seems like they're all either syndromes or complexes or disorders, and such as depression, stress disorder, anxiety, panic attacks, worry, anger, inferiority complex, PTSD syndrome. I want to come back to that one. Alcohol abuse, drug abuse, addictions in general, unworthiness, and the two biggies, fear and guilt. If there's anything that catches people's attention lately that I've noticed through the work that I've been doing is fear and guilt. And with regard to the PTSD, post-traumatic stress syndrome, I recall once, I don't know the exact words you used, but you spoke about even someone who has been in a war, and I think this is maybe on a video on your website, and has killed someone and is now living with that. I'm not sure how you put it. Something about even the mind can be cleared from that kind of suffering.
Yes.
And it is true. Now, this is where this speaking the truth is leading up to the talk therapy with someone who's safe to speak the truth with, is it not?
Yes. The trick to it is it's obvious that just like giving birth to a child, you could never not have given birth to that child. What the child does after that, obviously, is completely up to them. So your responsibility then was to have given birth to the child, and you can never not have done that. But what the child does after that is up to them. It's a little the same thing when someone takes another's life. There can never be a time when that person did not take another person's life. So there'll always be the memory of that. However, the linguistic action of speaking the truth can take the attachment away from that, can take the suffering of having done that, can take the misery of having done that away from the person. Now, as I said, the memory of having done it will never be gone, but the memory is never the detrimental thing. It's always the attachment to the memory that's the detrimental thing.
So basically you're saying that regardless of what resides in our memory that keeps coming up in the form of ghosts or whatever to haunt us in thoughts, worries, fears, anxieties, phobias, and all these other things, depression, addictions, which I assume may be used to get some relief, temporary relief, can be cleared.
Yes, as a matter of fact, as I talked to you earlier, I'm starting a transformational relationship coaching company or thing. It's going to be me doing it, obviously. That has to do with that exact thing. It has to do with the clearing of ourself or selves. Was that such a word? Ourselves through linguistics. Through that's why I was surprised to hear you when you say there's a new thing called, what did you call it?
Talk therapy.
Talk therapy.
Yeah.
Because if the experts are doing it, they're going to have it's not going to be a complete clearing of it, because what happens when experts discover something is they dole it out in small packages.
So that they can continue to keep treating it? Is that what you're saying?
Yes. The continuation of the treatment of it is the thing. So if someone ever discovers the truth of what it is that I'm speaking, then that can be broken into segments, so that for the next 20 years you can be visiting the therapist and going through talk therapy. That's what happens when professional psychiatrists and psychologists, I mean, essentially that's what they've been doing anyway. Essentially you pay psychiatrists and psychologists $150, $200 an hour, and essentially what they do is listen, or at least psychologists. Psychiatrists have recently taken the form of drug pushers more than anything else. They just dispense certain drugs to supposedly cause certain happenings. So any experience of life can be cleared by the one who experienced it.
What came here when you said that is that what I've come across, which seems to be a quote-unquote new therapy, talk therapy, even, what was it called? It was called talk. It was called, I can't remember. Had it on a paper. That's why I don't like papers, because I could never find them. The Talking Cure, I think, was it. But yet, it was discovered by, so it's new and it's old. But what seems to me to be the difference is they treat it, whereas what you're doing is transforming, well, not you, I mean the person who comes to you for this counseling service is actually coming, your intent is to transform it. In other words, exactly. To put yourself out of business.
Exactly. Yes. It doesn't necessarily mean that one time and bam, but what you said is true. It means to say that in the action of the person transforming themselves, the action of self-healing lives.
So the healing is actually, it's like the answer is in the question. The healing is in the...
The healing is done by the person, but it can be, as I said, dispensed out over 10 years or 20 years, or you can do it in probably a 6 month to a year, depending on, I mean, if my guess is if somebody had been to war and killed 1 to 20 people, there would be a whole lot of, because see what happens is that action of having taken someone's life would be the catamount, the paramount capper of all of those emotions and all those feelings. So that would be a difficult one for the person to actually become complete with, because they've taken another person's life. And essentially, when you take another person's life, you lose your own.
There is a way of transforming that, and I think that that's an important distinction to make between you and the quote-unquote PhD professional who will be writing manuals about it pretty soon.
Yeah.
Yes, 5.
Well, the thing about this, Ann, and I'm sure you know it, is that 30 years ago or 31 years ago, I'll see how I can put this. I was a robotic. I mean, I didn't know a thing about guru or talk therapy. I didn't know anything about any of this stuff. Not one. It never even entered my head. Other than maybe I had bought some when I first got married. I bought some books on how to have sex better or something. That was, and then that time in 1979. I went into, there was a time there that I knew absolutely nothing about this stuff, and then, bam, there it was. That's all I knew. I just became, like, all of it was visited upon me in a fresh burst of energy. And so all I'm saying is I didn't learn any of this stuff. I didn't go to any schools. There's nothing taught to me. There's no psychology or psychiatrist classes. None of that. It's just it is newborn intelligence, I guess you could call it. I've never called it.
So actually, there seems to be an advantage there in that you're not answerable to any manual on terminologies about mental disorders and therapies and how to do this and how to do that.
Exactly. I just see it clearly as it. I see it clearly as it is, and I have been speaking these things now for 31 years.